Thank you for coming. Tonight we're going to be discussing hypothyroidism. So we're going to discuss the thyroid broadly, and then we're going to narrow down towards that topic. It's a big topic. I'm going to try to cover it in a way that makes sense, in a way that all of us can understand, in a way that doesn't get too bogged down in details, but we are going to stick with hypothyroid as opposed to hyper and hypo, more because that's a more common, or at least the end game for a lot of thyroid disorders is hypothyroidism. So we're going to talk a little bit about that pathway tonight. We'll discuss some symptomology. We'll discuss the mechanism by which the thyroid works, and we'll discuss sort of what our approach as functional medicine doctors are to thyroid issues. Take-home message is probably the thyroid cannot be assessed with numbers alone, right? We can't get fixated on test results. So we'll talk a little bit about that too. And hopefully our understanding of the thyroid as a whole will help us understand why just a TSH doesn't give us the whole picture. So we'll go through the big picture, not the narrow picture, which I think is really the key to understanding and solving thyroid issues in general. We'll also have time for questions at the end. So if you have a question or a comment, please save that for when we're all done. And I'll try to get to as many as I can, okay? Sound good? Perfect. So hypothyroidism is very common. It's estimated that 1 in 8 people at some time will struggle with thyroid issues of some kind. Majority of those being women, 5 to 9 times greater in women than in men. So those of you who are men who are here, pay special attention because your doctor probably will not have thyroid on their radar when they're thinking about what some of these symptoms might mean for you, and it could look different for you as a man than it might for women. So that's important to know, right? Men should even be more educated on this topic than women because it's not on our radar. 60% of people, roughly, with thyroid issues don't know they have thyroid issues. So that's kind of staggering, right? We're not really digging into this. We're not, as a general medical community, we're not getting it. We're not catching thyroid issues. We're not taking care of them. 3 women that I have seen in my office, these are not their names, it's not exact, but almost every week I will see a woman in my office with thyroid symptoms. It's very, very common. Some people are like Sarah, where they hit menopause and all of a sudden the weight keeps piling on. She's not changed anything. She's exercising more, she's eating healthier, but she's depressed, she's sluggish, her metabolism is tanking, and she can't keep the weight off. She feels puffy, she feels bloated. Miserable. Amy is a young woman. She has a pretty high-powered job. She got her master's, went to graduate school, did really, really well, got into her field, and all of a sudden her energy just tanked. She just can't keep up anymore. She used to be very vibrant. She used to be very energetic, but she's having trouble sleeping through the night, waking up at 2 a.m., 3 a.m. consistently every night. Her and her husband have been trying to get pregnant for like 3 years, and they're having no luck at all. Julie is very thin. She's always been very thin. She's never had any problems with weight, but lately she's been having a lot of numbness and cold and tingling in her hands and in her feet. They'll even turn white and sometimes blue in the winter if they get cold enough. This has started to happen over the past year or so. Her hair seems to be thinning. It gets kind of brittle. Sometimes big chunks will come out, especially when she's stressed. Her nails and her skin are dry. These women are all examples of hypothyroidism. They might not present the same, they might not look the same, but all of those symptoms, all of those pictures can be tied to the thyroid. And that's because the thyroid is hugely influential in every system in our body. There is a thyroid receptor on every cell that we have, kind of like vitamin D receptors in every cell that we have. The thyroid is at work regulating these things, sometimes right in front of our faces and sometimes behind the scenes. So it's part of that interweaving of hormones and neurotransmitters and chemical signaling that happens in our body that has to be just right in this tiny little window for it to be optimum. It's amazing our bodies can do it at all, really. It's miraculous. But when it's not working right, it can look really different. So that's one of the things that's really tough about thyroid is you can see many different symptoms: fatigue, depression, even anxiety and depression, back and forth, weight gain, puffiness, bloating, extreme hot or extreme cold, always sweaty, always freezing, one or the other, these extreme temperatures. Sometimes throughout the day, you'll bounce back and forth between the two. Constipation's really common in hypothyroid. Hyperlipidemia, that means high cholesterol. Neurologic dysfunction, so that can be brain fog, forgetfulness. It can also be neuropathies, numbness and tingling in the hands and feet. Joint pain is really common in hypothyroidism, especially the autoimmune type. What fingers feel stiff. Joints start to hurt when you're working out, or especially if you quit moving for a while, when you sit down and then you stand up and everything's stiff and hurts. So lots of different things can present here with hypothyroid. And different people look different, which is, again, one of the reasons I think we're failing to treat this well is because generally medical professionals look for protocols. They don't necessarily look for patterns, and they certainly don't look for interconnected things. They try to treat everything in isolation. It's the opposite of what a functional medicine doctor does. We try to treat things in concert, right? We want to look at things logically and think if this, then that, right? It's just a different way of looking at medicine. So taking some of these symptoms and drawing some connect the dots, that's what we're going to try to do tonight, okay? Lots of other symptoms related to hypothyroidism too. I didn't talk about hair, I didn't talk about skin, brittle and dry. Lots of different things that can present too. So what I have here is I have the metabolism of thyroid and a figure here, and I love figures. And I'm going to walk you through this because I think it helps us to understand the complexity of thyroid, and also it will help lead us towards an understanding of where things can go wrong. So that's next. If we understand a mechanism, then we can find areas that need help and actually get at the cause. Make sense? Nod your head. Yeah? Okay, thank you. So we've got our central regulation here, right? So we've got the brain. The brain's the first part. Even before this, we have the hypothalamus of the brain that starts this whole cascade. Hypothalamus talks the pituitary. And then we have our first measure here called TSH, thyroid stimulating hormone. Okay, this is a really common one that we'll see, a common lab that we'll see drawn. This is the pituitary, okay? So that's not the thyroid yet. This is still part of the brain that has to do some work here for us. So pituitary down to the thyroid gland. So this TSH goes and talks to the thyroid. And the thyroid produces two different things, T4 and T3. Just a little bit of T3. A lot of times it's so small that we just ignore it, but there is a little bit of T3 that's formed straight from the thyroid. Mostly it's this T4 called thyroxine, okay? That's T4. From there, we turn thyroxine, which is not the active form of thyroid hormone, into T3. This is the active form of thyroid hormone. This is what does things in our body, right? T4 can also be turned into something called reverse T3. Reverse T3 is inactive. Doesn't do anything in our body. Okay? So there's two pathways that can happen from T4. It can go to T3 or reverse T3. We'll talk about reverse T3 and we'll talk about what drives that pathway in a minute. Okay? But remember, this is not active. This doesn't help us do anything in our body. It's just, it's inactive form. And then from there, in the periphery, again, this is in the outside of our body, not in the thyroid. It's in our liver and in our other tissues in our body, fat cells and skin cells and digestive system cells. Then that gets changed into T2, which is the inactive, used up version of thyroid. Okay, so once thyroid does its job, an enzyme comes in and turns it into T2, and then it's recycled. Okay, so we have the brain, central regulation, peripheral regulation, which we're going to talk a lot about, this T4 to T3 thing. And then even beyond that, what does T3 have to do next? So we'll get into that in a second. Periphery. Now, we've got two other things measured here that don't have to do directly with the metabolism, but I want to point them out now because they'll come back. We'll talk about them in a second. But we've got antibodies here. Okay, so when we're talking about autoimmunity and thyroid, that's where these come in. So when your body makes an antibody, something to attack something, right? It's part of our immune system. That antibody will go and neutralize. Okay, so where that comes in is the thyroid gland. If you have antibodies, they will attack the thyroid and they cause it to be inflamed and not do its job very well, and they can destroy the thyroid. So antibodies is something sometimes we'll also look at when we suspect autoimmune thyroid issues. Okay, so pituitary, just to make sure we got it, pituitary, TSH down to thyroid. Thyroid T4 is what we get. Then T4 gets changed into T3 or reverse T3. Okay, we'll talk in the next slide, we're going to talk about what happens next. But nod your head if you understand that far. Okay, cool, that's perfect. And then we've got, again, these antibodies to the side that we'll talk a little bit about too. So this figure is actually from a test that we run through Genova Diagnostics that gets us a full look at the whole thyroid metabolism. Usually when you go see your primary care doctor, they're just going to run a TSH. We'll talk about these tests again later. But this is a nice figure that shows us where all of those things are active. So that's why I wanted to point that out to you. If you had questions about your own thyroid, that's something maybe you can talk to one of your DBC doctors to run, or you can look at some of these with your primary care doctor. So what could go wrong? A lot of stuff. Shoot, that's the problem, right? That's the solution and the problem is right here in what could go wrong. So we've got our hypothalamus pituitary, right? So we may have something inherently wrong with our brain, which means that we don't make enough thyroid releasing hormone that talks to pituitary, or a pituitary might be in trouble for some reason. If that's happening, then you can get thrown off from the brain itself. Pretty rare that this is an issue that you don't find right away. Usually this is discovered very early on in life if there's issues with these things. But moving down further along the cascade, we've got the thyroid gland itself. So this is where our conversion has to happen, right? Where we have to make that T4. This is our autoimmunity, right? So if we're thinking autoimmune thyroid being attacked, that's what's happening here. If we've got something going wrong with the gland itself, cysts are being formed, we've got inflammation in the area, tissues being destroyed, think autoimmune thyroid issues, okay? Moving on, what has to happen with thyroglobulin is it has to be turned into thyroxine. So that happens in the thyroid, right? So if you've got a bad thyroid that's not doing its job, this thyroglobulin has to be turned into that T4, right? Thyroglobulin to T4 is where iodine comes in, right? We think about the thyroid and we think about iodine. So we need iodine to be able to bind to this molecule in order to make this molecule. So if we don't have enough iodine, that's a problem, right? Michigan is known for having poor soil quality when it comes to iodine. We just don't have a lot of it in our soil, partly because we were never by an ocean. So we never had seaweed, right? Coastal areas, anywhere that used to be ocean, tends to do better with iodine in the soil. I know, crazy, huh? I didn't even think about that. That's super interesting. Another thing that can prevent our ability to put iodine onto this thyroglobulin are halide molecules. So that's chlorine, bromine, fluorine. Where are these things found in our environment? Anybody know? In the water, yeah. So unfiltered water, if we have halides in there, they can compete with your body's ability to bind iodine, okay? So that's where toxicity comes into play, right? If we have these halides in our environment and our body has those competing with our ability to bind iodine, then we're going to have iodine deficiency and we're not going to be able to make this thyroxine, okay? Not something we usually measure, not something we usually think about, okay? If you have enough iodine in your system, people don't think about whether or not it can bind, okay? So that's something that we need to make sure happens. So that's our iodine step. So that's what can go wrong there. T4 to T3, right? Inactive to active. This requires selenium. Okay, so if you have mineral deficiency in your diet, do you likely have enough selenium to do this conversion? Probably not. The reason we know that a lot of us don't have enough selenium is because a lot of us have diabetes type 2, which is also correlated with a lack of selenium. Diabetes is, and insulin. Okay, so selenium's really important for this step. T3 has to bind to a receptor on the cell, okay? This is a step we're going to talk a lot about in a second. So that binding requires vitamin A. Okay, vitamin A is needed for this. Vitamin A is only absorbable in certain forms, and we're going to talk a little bit about that too. One other thing about vitamin A is that it can be diminished by chronic viral infections. So I have a patient who had mono for a long time as a high school college student. And her vitamin A is totally depleted and she's having lots of thyroid issues. So that's really interesting too, right? We don't necessarily correlate a chronic virus with thyroid issues, but one can cause the other because vitamin A. T3 receptor complex, so once this binds, this has to bind to the DNA on our cell and come into the cell and talk to the cell to make certain proteins that do what thyroid does. That's the simplest way to think about it, right? This requires vitamin D. What is the biggest deficiency in Michigan in people? Besides water, vitamin D, right? Vitamin D is huge. Most of us don't get enough of it. And it's fat soluble. So if you're not eating enough healthy fats, you're going to have a hard time absorbing that vitamin D. Vitamin D quality in supplements is very poor. So a lot of times by the time you get that supplement, there's no vitamin D left, or it's changed and bound into a non-usable form. So what can go wrong? A lot. So a lot of people say, oh, it's so complicated, I'm never going to figure it out. Well, functional medicine doctors go, awesome, I have an input here, I have an input here, I have an input here. I can fix this, and I can fix this. Right? We've got lots of ways we can plug into this system besides just saying, here, take some thyroxine. Right? That's the difference. That's what's exciting about functional medicine is we aren't limited because we can look at the big picture. Make sense? Cool. You guys with me so far? Good. So, if your numbers are normal, this is the look you get, right? I have run into very many frustrated people who have been brushed aside with their complaints because their numbers are normal. Okay? It's a very frustrating experience because you know something is not right. Your body is telling you something because your symptoms aren't better. Your hair is still falling out. You're still gaining weight. Or it helped for a second and that has stopped helping now, right? It worked great for a while, but your numbers are still normal and all your symptoms are back. So this conversation is horribly frustrating. And I know so many people who have been in this place and end up in our office looking for this, right? So we need to make sure that when we get this as a response, we move forward. We push our doctors. We press forward, okay? That's something that I want to drive home, is that just because your numbers are normal does not mean there's not something wrong. Nod your heads if you understand. Good, perfect. Raise your hand if you've been there. Yeah, exactly. Okay, so we're going to go beyond normal numbers. So what are some of those numbers that we sometimes get? Well, the most common is TSH, an extremely limited measure of thyroid function. But it is the standard panel. I have a lot of patients who struggle to get their doctors to run anything besides a TSH, unless they're an endocrinologist. But getting there is a tough process. We saw that whole cascade, and now we understand why that doesn't show us the big picture, right? It has nothing to do with if your thyroid hormone is reverse T3 or active T3, right? How could we possibly know based on TSH what's going on? The other thing that's a little bit sinister about TSH is that over time, over the years, right, decades even, we've seen normal numbers for TSH change to fit our population. As our population gets sicker, our normal numbers change along with that, okay? So that's a problem, right? Just because it's normal doesn't necessarily mean it's optimal function of the thyroid. So we are wary of TSH by itself, especially in this office. It doesn't tell us enough, right? So we've got more numbers we can look at. We can look at T3. We can look at T4. We can test reverse T3 to know if our T3 is active or not. We can test for these antibodies. Here's something I hear a lot. Yeah, my TPO is elevated, but not high enough that they'll do anything about it. Wait, what? We know there's a problem, but it's not bad enough of a problem? Like, really? We're going to wait until you get sicker before we treat you? It seems ridiculous when you think about it that way, right? We also, in this office, will do an iodine skin test just to see if you have enough iodine in your system. All that involves is putting some iodine on your skin and seeing how long it takes for your body to absorb it. Pretty simple, right? We also will do basal temperatures. So we see if your body is heating up enough. If it's not heating up consistently enough, then we know there might be something off with your thyroid because it regulates temperature. Okay, very simple tests. But a lot of times, if we know that there's a thyroid issue, this is all we need to get started. Because we don't have to know that there's thyroid antibodies. You can feel it. You're swelling in your throat, right? These are some things that people already know about themselves. Sometimes these things become unnecessary or unhelpful, especially if they're all normal. Okay? So these are some of the tests that you will see run. And you saw that full panel that we had. Sometimes we'll run those. If your doctor will not run these tests for you, these are tests that you can have access to through this office. So that's something that you should know. Sometimes we will get these tests run on our own if we need to. Sometimes doctors are fine with it. They'll shrug it off. Sure, I'll run it, whatever. Sometimes your insurance won't cover it. It kind of depends. But this is kind of where we are with testing. Again, it doesn't tell us the full picture, so it's of limited value, but sometimes you'll see these tests. Okay? What I want to talk more about is something called subclinical hypothyroid, or the concept of thyroid resistance. Who here has heard of insulin resistance? Cool. So the same concept applies to thyroid hormone. So you can have insensitivity of the thyroid receptor, or an inability for normal amounts of thyroid in the circulation to bind to those receptors, which means, just like with insulin, you might run normal numbers, but they're not functioning. You're not getting the function of thyroid because it's not binding. That complex isn't functional. Make sense? So subclinical meaning you're not seeing abnormal numbers, even though you have every single symptom and indication that you have hypothyroidism. So in this office, we want to embrace that because subclinical hypothyroidism can lead to clinical hypothyroidism. And sometimes then it's too late. So we don't want to wait. We want to treat this while it's here in this stage. Okay? Does that make sense why we would do that? Yeah. So altered receptor sensitivity or the cell's response is what we want to get at here. A great example of this when we talk about functional medicine has to do with vitamin A. I mentioned that before, right? That we need vitamin A to bind the cell, right? So that thyroid receptor needs to bind to the cell, and that requires vitamin A, okay? Retinoic acid is the type that it requires. Main way that we get retinoic acid from our diet, the main way we get vitamin A in our diet is beta carotene. Those are not the same things. Where does beta carotene come from? Anybody know?
Carrots.
Orange colored things. Carrots. What else?
Orange bell peppers.
Mm-hmm. Cantaloupe. Squash. Mango. Sweet potato. You know what else? It's in kale and spinach, because everything is in kale and spinach. It's just the orange color is just blocked by the chlorophyll for photosynthesis. That's why you don't see it come through. But yeah, so beta carotene from our diet, lots of great sources. What has to happen is conversion from beta carotene into retinoic acid in order for it to help T3 bind. Those of you who are familiar with this office, where do you think that happens? The gut, the intestinal mucosa. So what if you have Crohn's? Do you think you're more likely to have problems with your thyroid? Because you can't turn beta carotene from your diet into retinoic acid, which means you can't bind T3 to the cell, which means you have thyroid resistance. Weird, huh? Kind of mind-blowing if you think about it. If you can follow those kinds of steps, that's how you understand functional medicine. That's how we try to get at stuff, is by taking those next steps and saying, what if, right? What if we have this issue in our gut? How might it affect our thyroid? How might it affect our brain? How might it affect other things? Functional medicine very much comes back to the gut, and these are the kind of reasons why.
Would leaky gut be a problem here too?
Absolutely. Okay? Makes sense? So really complex stuff. So you can be eating all the carrots that you want, but if they're not getting absorbed, if your gut is inflamed, you might still end up with thyroid resistance. And your thyroid numbers still might be normal. Shoot. Okay? Make sense? What else affects thyroid? Adrenals. These guys play together a lot. Here's why. When cortisol goes up, cortisol being the long-term stress hormone that our body makes, when our adrenals are fatigued, when they're under a lot of stress, it makes reverse T3. It pushes the pathway away from T3 to reverse T3. Why don't PCPs, why don't your regular family doctors test for reverse T3? Because there's no drug to fix that. And most of the time, they don't even think that adrenal stress is a real thing.
Really?
Absolutely.
They don't learn in school.
It's just something that isn't talked about yet. It's starting to get there. But it's hard for them to fix. So they get a bad RT3, right? They know that it's off. Well, what are they supposed to do about it? We look at it and we say, perfect. We got to work adrenals. We got to lower your cortisol. We got lots of ways to do that. Okay? So that's the connection. Stress being the common denominator. And the other tricky thing about adrenals is that it's hard to differentiate adrenal fatigue symptoms from hypothyroidism, right? They look a lot alike in certain cases. And so as a functional medicine doctor, oftentimes I will go after adrenals first, because I know that if adrenals are off, this is going to be off anyway, right? My thyroid is going to be resistant. I'm not going to have active T3 anyway. So if I can hit the underlier, which often is adrenals, then I can get things up and rolling. And sometimes this thyroid-y stuff makes its way out of the picture because we're treating what's actually underlying. They're making enough. They're converting. They're just converting to the wrong pathway. So if we can keep them converting back to T3, then we've solved the issue. Make sense? Cool. Thyroid and adrenals, that connection is there. So what do we do to treat adrenals? Manage stress. Can anybody think of a lifestyle way to manage stress?
Walking,
Great. Meditation, wonderful.
deep breathing.
Good. Seeing a counselor. Yoga. Okay? Lots of different ways that we can manage stress. Stress management does not mean move to Tahiti. I wish it did. I would love to prescribe that for somebody, but that's not realistic for most people, right? So a lot of times when I start talking about stress, I can see patients' brains turn off because their PCP has said to them, it's just stress. I really hate that phrase, it's just stress, because there's no just about it. It's stress. So what? What do we do then if it's stress, right? We don't think our way out of stress. We don't pull ourselves up by our bootstraps and not be stressed. Just stop being stressed. That's what it sounds like to me, which is completely unfair and unhelpful. And that's why when I talk to patients about stress, I emphasize what we do about stress, right? Stress exists. How our bodies react to it is what's important. So managing that stress is one way to help your adrenals. Reducing your inflammatory load. That's food, right? Our inflammatory load is about food. That is the biggest source of inflammation that's possible in our bodies, comes from food. So if we fix food, maybe we clean up some detox pathways, right? We make sure we filter our water. We reduce that inflammatory load. We figure out if there is any triggers specific to you, foods or other environmental things that trigger inflammation. If we can get that under control, adrenals will not be as stressed. It's a way to manage stress. Because inflammation is stressful for the adrenals too. It becomes a catch-22. We need to metabolize excess cortisol. We can't let it just hang out in our bodies. That's destructive. And there are nutrients and there are herbs that we can use to do just that. And we need to heal the adrenals. We need to feed them. We need to baby them a little bit, right? Give them a little TLC. Two of the ways that we do that are using specific blends. One is Adracet, one's Exhilarin. We work with adrenals a lot here at DBC. There's a lot of different things that work for a lot of different people. Sometimes it takes a couple tries to get it right. Sometimes one works really well for a period of time and then not, and we have to switch it up. Adrenals are complicated, but we've got lots of options. So working with adrenals is huge for dealing with that thyroid resistance, dealing with hypothyroidism. Autoimmunity is another big part of this story, right? We've heard these words before, Graves, Hashimoto's, right? This is a tongue teaser, right, that we get a lot in the room. I've got the Japanese one. I heard that once. I've got the Japanese one. I know what you're talking about. So Graves is hyperthyroid. We're not touching much on that one. Hashimoto's is hypothyroid, right? When we talk about autoimmunity and thyroid, we always talk about gluten. We know that gluten tends to be inflammatory to most people, right? So anything that's altering the inflammatory levels of the gut is going to be problematic for the thyroid and for most body systems, right? We understand that. However, gluten specifically mimics, it's called a molecular mimic. It mimics thyroid antibodies. So the cross-reaction that occurs between gluten specifically and the thyroid is well documented. Now, they talk about it mostly in celiacs, but it also does exist with any kind of gluten sensitivity. It is just something that if you've got thyroid issues, you really should be 100% gluten-free. And I'm not always a stickler about 100%, but in this situation, if you have Hashimoto's, that cross-contamination, that mimic is so strong that even tiny bits can really inflame the thyroid. Okay, so that's the first thing that we talk about with patients, because there have actually been documented cases of people in full-blown Hashimoto's who go gluten-free and completely reverse all their symptoms just from changing that. Everything can reverse. They can get off Synthroid, they can have their antibodies go away, just from that point. That's not everybody is that dramatic, but sometimes that will happen. And enough times that gluten is an irritant to the gut that it's a good idea to stay away from it if you have any autoimmunity, particularly thyroid, Hashimoto's. Anytime the immune system's in overdrive, we talked a little bit about this in vitamin A, right? We know that we need that vitamin A in a specific form in order to bind. So with people who have normal thyroid numbers, but we suspect that they have that thyroid resistance, we always want to make sure that we're not using up all of our vitamin A with some sort of immune system overdrive, and autoimmunity is a real tax on the immune system, right? To constantly just have a chronic immune reaction to your own body is very stressful and can cause a lot of inflammation, and it can deplete you from specific vitamins and minerals that your body needs. So when we're talking autoimmunity, we're talking about the gut. So how gluten contributes to thyroid? Well, it's a bit of a Medusa, right? It's a Hydra's head. We've got all these different ways that it can affect us, whether it's leaky gut, that impermeability that will affect us. We've got protein deficiencies that happen. Vitamin A, we mentioned that. Vitamin D as well. Iodine because of the vitamin A and the halides. Magnesium. So there's a lot of ways that it can contribute, but the biggest one is that molecular mimicry that I was talking about before. Does that make sense? Do you understand that part of things? So when a molecule is supposed to bind, right, there's a receptor. And if I've got a square antibody that fits a square receptor, if I've got an antibody that looks kind of like a square, maybe it's a square but with one corner cut off, that might get confused on this receptor, and it can cause a cross reaction. So I've got an antibody to gluten that has the little square cut, or the corner with the square with the corner cut off, and I've got a receptor for an antibody to thyroid over here. So the gluten binds to the thyroid, which causes the immune system to attack the thyroid because it looks like it fits that receptor. Make sense now? Okay. So what do? The first one is do not wait. If you think that there's an issue with your thyroid, don't wait to treat it. If you've got autoantibodies to your thyroid, even if they're just a little bit, don't wait to treat it. There's lots of steps that you can take to prevent this from becoming a full-blown issue, okay? We don't want to destroy our thyroid. We want to save it if we can. We want to get on top of it right away. We want to eliminate triggers. Gluten, we just talked about that. We want to make sure that we're not having any other autoimmune triggers going on in our body. We want to replace the nutrients that we don't have enough of. Vitamin A, selenium, vitamin D. We talked about those specifically, but other nutrients that your body needs. Iodine, duh, forgot that one, right? Need to replace those nutrients. Both of these things have to do with food. So we always work with food. Food's the best medicine. It's the first medicine. We need to address adrenal fatigue almost every time to make sure that we're making not reverse T3, right? Active T3 that can bind and do its job. We need to eliminate our exposure to toxins, particularly chlorine, bromide, fluorine. It's common in our water. But most of all, we don't want to wait. Don't wait for your numbers to be abnormal. There's lots of things we can do in the meantime. I just listed some of the things that we use. I'm not going to dive into these because most of these require a little bit of work to figure out what's right for you. Not necessarily something that we're going to just go into the store and try because they're kind of strong and they're specific. Thyrosol might be the exception to that. Thyrosol has all of the ingredients you need for every conversion made by your thyroid. So I tell people it's a multi for your thyroid because it's specific to all of those cofactors and all of the things that you need for your thyroid to function properly, all the steps along the way. So very valuable. A lot of people with early thyroid issues, if we take care of this and we clean up their diet and we manage their adrenals, then we're good to go if we get it early. Iodine synergy is what you think it is. It's a specific form of iodine that's readily available and easy for the body to use, to break down and to absorb. Okay? All iodines are not created equal when it comes to absorbability, and this is the one that we found works the best. Biothyro is a glandular. We don't use a ton of glandulars in this office. This might be maybe the one exception to the rule that we have. I know we used to have other ones, but this actually has, from animals, thyroid ground up in it, as well as hypothalamus and pituitary. So the theory being that if you need support in any of those, or if you need ingredients for any of those things to repair, this can be helpful for that. Okay? Ultra-Inflamex, anytime we have to fix the gut, this is a good one to go with. Coats the intestines, helps leaky gut, reduces inflammation. Okay, that's a pretty standard one for any time we're dealing with any gut-related issues here in this office. And then I mentioned Adrocet and Auxiliarin to help metabolize excess cortisol, to help heal the adrenals. So these are some ideas, some things that we might use with folks depending on what's going on to help work this system in the right direction. These are no substitute for things like nutrition. They're no substitute for stress management, but they can help us along the way. Make sure we have the right nutrition and what we need to make all of these really complex things happen along the way. So really, thyroid, and I was actually pleasantly surprised when I was doing research for this topic. Thyroid is an excellent example of where functional medicine really thrives. It's one of those things that does take into account almost all of the spokes in this wheel. And if we get a chance to look at it from that perspective, instead of reducing it down to just numbers, if we actually take a good look, we have a lot of ways to work with the thyroid, even if your numbers are normal. Which means functional medicine is really ideally suited for these kinds of issues. Especially if we're dealing with autoimmunity, especially if we're dealing with the gut. Something complex like this really responds well to the kind of treatments and the therapies that functional medicine doctors do, because there's a lot to work with. It's very confusing. It's very complicated, but we consider that to be a good thing in this office because that means it's integrated. So all of the different things that we plug in can be helpful for this issue. So the next time you feel belittled, the next time you feel like you're not being heard by your doctors or by someone else who says, it's all in your head. Oh, your numbers are normal. There's nothing we need to do for you. Oh, right, that look. Remember these different things. Remember thyroid resistance. Remember subclinical hypothyroid. And try some of these things out. You can change your diet. We can help with that if you need it, but there's a lot of different ways that we can address these issues besides just shrugging our shoulders at normal numbers. So be encouraged, hang in there, hang tough, keep searching. We can figure it out. Thank you very much for coming. I really appreciate that. I know it's summer, it's hard to not be inside, but thank you. Thanks very much. Appreciate it.